are symptomatic.
Hi, Jamie. Just in addition to, because I think we have, I would never in any way contradict my good friend Tony Fauci, such an eminent man. There are many different estimations of what might represent asymptomatic transmission or other infections in the community. And we do know, and everyone accepts that when the seroepidemiology studies do come online, we will probably find more people who've been infected unknowingly. There's no question of that. The thing we need to address in all of this is very often the idea of severity versus infection. And there is a huge association between the dose of exposure and the severity of infection. We see this in many other infectious diseases. So we also probably need to look at who is getting sick or very sick, and is the dose and the type of exposure they're getting different to those who may be exposed and seroconvert in the community. So it's not just a matter of looking at how many people in the community are infected, but are there specific elements of exposure that cause individuals to have a higher dose of exposure, or a specific route of exposure that causes a more severe infection. There's also that concept of infectious dose when we talk about the different types of transmission. If somebody is exposed to a high dose from another individual directly, or from a surface that's heavily contaminated, you can imagine a large dose. In other circumstances, individual particles or virus particles potentially floating through the air, it can be demonstrated that that may happen in certain circumstances, certainly in healthcare settings. But is that significant in terms of driving infection? Is that significant? Does that produce an infectious dose that can successfully infect another individual? And these are all very important things that still need to be studied. Again, we're only a number of weeks into this. I think we need to have the seroepi studies. I think we need more information on what is the infectious dose, and particularly the relationship between the dose of exposure or infection and the severity of the disease subsequently, which has been seen with many, many other diseases in the past, including cholera, Ebola, and others.
Thank you very much, Mike and Maria. We will go now to next question. That's Kai Kupferschmidt. Kai, can you hear us?
Yes, Tarek, thanks a lot for taking my question. So I just wanted to ask about, the global push to try and find a pre-exposure prophylaxis or post-exposure prophylaxis. I understand there's several trials going on, most of them with chloroquine or hydroxychloroquine. I was just wondering whether you can speak a little bit to, what role this could potentially play. And of course, also, there's a lot of smaller studies going on. Is there any way to make sure that they all lead to results that can be pooled in the end?
Maria can give you more detail, but certainly one of the Solidarity trials, I think Solidarity 3 or 4, we have one of the trials under design, which will be a multi-center study, which will look at prophylaxis in healthcare workers to see whether there's evidence that giving lower doses of drugs like chloroquine or hydroxychloroquine to health workers would reduce their risk of becoming infected in a healthcare environment. Those studies are certainly underway. And again, there are a number of those studies underway in smaller studies around the world. But again, as WHO, we're trying to bring together a larger set of collaborative studies that will give us the answers we need. In terms of post-exposure prophylaxis, I don't believe we have at the moment a studies plan, but Maria can speak to that. But there is certainly evidence for the use of, not proven evidence of effectiveness, but there are a number of studies underway and trials underway that use hyperimmune globulin in the treatment of disease. In other words, they use the plasma, purified plasma of recovered individuals to give an antibody boost to people who are suffering the disease. Similar approaches have been used in post-exposure prophylaxis for other diseases, but Maria may be aware of studies underway in that area.
Only to add that we have, as you mentioned, there are a number of smaller studies that are happening globally and across a large number of countries. We have teams through our science division and through GORN, through the Global Outbreak Alert Network, who are pulling together available literature on a number of topics, one of which is actually looking at different types of therapeutics and drugs. And the idea is until we can actually have a study that pulls together enough of a sample size to get these answers to these questions, we're trying to evaluate every piece of evidence that is published so that we could look at the way in which these studies were done. We can look at the strengths, we can look at the limitations, so that can help guide us closer towards an effective treatment for COVID-19.
Thank you very much. Next question is from BFM Radio. Is it Kate who is from BFM Radio with us?
Yes, hi, good evening or good morning. I'm actually from BFM Radio Malaysia. My question is that many countries around the world, they have imposed lockdowns or some sort of restrictions of movements of. So I was just wondering what WHO's guidance would be. What's the sweet spot, so to speak, the kind of data that governments need to consider before lifting or relaxing some of these lockdowns? Thank you very much.
Thank you. It is a difficulty for governments right now because the lockdowns in many situations are proving effective in dampening the flames of the epidemic in those countries. But those lockdowns are also causing great economic hardship, and everybody, especially in the developing world, needs to get to a more sustainable way of managing this epidemic and controlling COVID-19 without continuing to damage economic and social life. The transition strategy out of lockdown requires a calibrated, stepwise approach. It would be probably very inadvisable just to lift a complete lockdown, all of the measures, because lockdowns are a general term that include closure of schools, closure of churches, stay-at-home orders, closure of workplaces. It's a mixture of different things, and I think each government needs to break out what does our lockdown actually constitute? What are the elements of our lockdown? Where is that happening in the country? Do we now understand the epidemiology of the disease in each area in which we have an element of lockdown or shutdown? And then to chart a path out, you have to build strong public health capacity to take over from the lockdown. In other words, the lockdown is pushing the disease down by putting people back in their homes, by separating communities. Once you raise the lockdown, you have to have an alternative method to suppress the infection. The way to do that is active case finding, testing, isolation of cases, tracking of contacts, quarantining of contacts, and strong community education and participation and ownership around normal physical distancing, hygiene, and giving communities the power to control infection by in effect, managing their own physical distance, managing their own capacities to support the response. In that situation, if you have strong public health capacity, if you've got a community that's mobilized and empowered, and if you've strengthened your health system, then you're potentially in a position to start unlocking or unwinding the lockdown. The specific parameters you need to be looking at are things on two sides. One is it would be very inadvisable to lock down if the number of cases coming through the hospital are already at a level where your occupancy of beds is nearly at 100%. You need to be in a position where you now have free beds in your system so that you're managing and coping with the caseload. And that means you have some absorption capacity left. You need to look at things like the doubling rate. How many days does it take for the number of cases to double? You need to look at positivity rates. What proportion of all samples that we test are positive? You'll see in somewhere like Korea, they're testing 2 to 6% of their samples they test are positive. Last week in New York, 37% of tested samples were positive. So you need to carefully look at what proportion of people I test are positive. You need to look at the number of contacts that are generated per case. And it goes on. And WHO will be issuing guidance to countries that is much more specific around the parameters they should be looking at. There are no absolutes here. There are no answers. There are no numbers that say, if this number is this, then you do that. That doesn't exist. But what we can do is offer countries very specific measurements that they need to look at to chart the path out of lockdown. And that stepwise approach of unlocking somewhat and then waiting to see. I think you need to say we will stop doing this element of the shutdown, and then we will wait and we will look at the data. And if that works, we go to the next stage and the next stage. So a careful, calibrated, stepwise exit from lockdown with putting in place public health capacities, putting in place community capacity, building the capacity of the health system to cope should the disease bounce back up. That's the safe path out of lockdown. We want to achieve it as quickly as possible. And we want to avoid many countries going into that circumstance. And we still have many countries around the world who are not in a lockdown situation. In fact, their epidemiology would suggest they can avoid the worst of this. And we need to support them to avoid them going into that situation. The most damaging lockdowns are in many developing countries where people, as the DG has said many times, can live from hand to mouth, not from paycheck to paycheck, but from day to day. And we have to find adapted solutions around lockdown and around disease control in vulnerable peri-urban populations living in poverty, in poor rural communities. And we have to find other ways to manage, alternative, adapted ways to manage lockdowns or slowdowns or shutdowns in those situations.
Thank you very much. So this was Kate from BFM Radio from Malaysia. Now we will go to Nigeria to Metro Star, and it's Innocent. Innocent, can you hear us?
Thank you. Can you hear me?
Not very well, but we will try. Please go ahead.
Okay, thank you for taking my question. I have two questions to ask. One, how will WHO assess Africa country and what they've done concerning the lockdown and management of COVID-19? And then the second one, there's a news going around that vaccines are to be tested on Africa when it's developed. How true is that? And is there a window that in the nearest future, vaccine will be developed for COVID-19? Thank you. Hello?
Yes, we are just trying to make sure that we understood the question. So, yeah, but we will try.
I think this is Nigeria, is it? Yes. Yeah. Maria may answer the question around vaccine development. With regard to our general assessment on lockdown, and the Director General may wish to comment on this because he's been speaking with many leaders in Africa, and I believe spoke with the whole of the African Union leadership and countries late last week. So therefore is in a much better position than me to speak about that. We would characterize, so far Africa is actually doing well in this response thus far. Countries have essential capacities for testing. Many countries are taking strong action and want to really focus on finding cases and doing contact tracing and trying to stop this disease becoming much more extensive, given the fact that health systems are not as strong in many countries. They need support in that, though. They need support in testing. They need support with protective gear, and they need to be given the resources to be able to mount those types of responses. So I would characterize that Africa has not suffered the worst of this pandemic so far. The worst of it can be avoided with very, very swift action to support those countries in Africa who really do want to take a comprehensive approach to this disease. With the many vulnerable people, including refugees and migrants who live in those countries, it is, I suppose, our responsibility to provide that support. But DG, you may wish to speak about your interactions with the African Union countries.
So I'll answer the question around vaccines. So what we can say is that there are a number of vaccines that are in development, and vaccines will be tested through clinical trials with all ethical considerations in place in whichever populations are under study, with informed consent, with open and transparent communication, This is of the utmost importance. Not only do we have strong, robust scientific evidence, but we ensure that all of the studies that are done with appropriate and the highest level of ethical considerations. One thing, if I could just mention on the first question around Africa, is that there are a number of countries in Africa right now which have very few cases. And Mike has alluded to this in his earlier response. Very few cases. Some only have imported cases. And there is an opportunity here. This window of opportunity that the DG has spoken about exists in many countries still. There is an opportunity to prevent the worst from happening in a number of countries across Africa and across countries that are still seeing their first case in some island countries. And we need to support those governments, those countries, all of the people in those areas to prevent the worst from happening, to prevent these individual cases from becoming clusters, these clusters from becoming community transmission. And I think that's where we need to put a lot of emphasis on and a lot of support on, so that we can prevent countries from reaching a point where they need to put in these very restrictive movement restrictions.
Thank you. Thank you for that question, my brother from Nigeria. On the situation, as Mike said, of course, when you see the number of cases, the African continent has the lowest number of cases so far. But that doesn't mean that, the situation will not deteriorate. It may. So Africa should do everything to prevent this situation from getting worse. And that's why African leaders are doing their best. I had a chance to participate in a meeting, a leaders coalition, which was arranged or invited by the current chairperson of the African Union, the President of South Africa, President Ramaphosa, and many leaders from all corners of the continent have actually participated. And the main agenda is to have a continental strategy and also, make sure that that continental strategy helps the national strategy. But in addition to coalition of political leaders or the heads of states and government, they have also agreed to have business leaders, coalition of business leaders. And business leaders in Africa are also getting together because Africa will need resources. And one of the major problems that was identified during the discussion was especially shortage of equipment, starting from medical equipment, test kits, PPE and test kits, and so on. And the leaders have agreed to look for concrete solutions to address the problem. And they also believe that, considering the number of cases we have in the continent, testing cases, tracing contacts and isolating them, and meaning using the comprehensive approach will actually help. They believe that lockdowns alone may not help, or the physical distancing alone cannot help. And they have agreed to do everything to follow the comprehensive approach. And from WHO side, we have been supporting, and we improved the testing capacity in Africa significantly in the past 2 months, and many countries in Africa have now testing capability, although we may have shortage of test kits. But we're working on that too, and we're finding different ways of addressing the gap. But we will support the African Union, we will support the Africa CDC, and also we will continue working through our regional office in Congo, Brazzaville, our WHO regional office, and continue to support and fight the pandemic together. Then on the vaccines issue, there was, I think, a comment last week from some couple of scientists who said the testing ground for the new vaccines will be Africa. To be honest, I was so appalled, and it was a time when I said, when we needed solidarity, this kind of racist remarks actually would not help. It goes against the solidarity. Africa cannot and will not be a testing ground for any vaccine. We will follow all the rules to test any vaccine or therapeutics all over the world using exactly the same rule. Whether it's in Europe, Africa, or wherever, we will use the same protocol, and if there is a need to be tested elsewhere, to treat human beings the same way, equally. And the hangover from a colonial mentality has to stop. And WHO will not allow this to happen. And it was a disgrace, actually, and appalling to hear during the 21st century from scientists that kind of remark. And we condemn this with the strongest terms possible. But we assure you that this will not happen in Africa and will not happen elsewhere in any country. Proper protocols will be followed, and human beings will be treated as human beings, because we are all human beings. Then, after saying this, the vaccine development, we're addressing two issues, and we will be announcing as soon as possible, hopefully during this week, a big initiative to accelerate the research and development and production of vaccines, and also design mechanisms for equitable distribution of the vaccines. While we're looking for vaccines, unless we break the barriers to equitable distribution of the products, whether it's vaccines or therapeutics, we will have a problem. So we need to address the problem ahead of time. We need to address the problem of access or challenges to access ahead of time. And that's why we will put together a mechanism, and we will appoint senior people from the North and South that will work out the details on how they can accelerate production, but at the same time, how they can ensure equitable distribution. And solidarity is very important here. When a vaccine or a medicine is ready, we have to be able to deliver it to all over the world. There should not be a divide between the haves and the have-nots. If we say solidarity, solidarity should be in its full form. And I hope each and every individual, each and every human being will go for that kind of solidarity. I thank you.
Thank you very much, Dr. Tedros. We'll take a couple of more questions. We go to Yang from Xinhua News Agency. Yang, can you hear us?
Can I hear you?
Yes, we can hear you. Please go ahead.
Okay. As the World Health Day is approaching, do you have to say to the Chinese? What do you have to say to the frontline medical workers in China and around the world in the global antivirus efforts? And this question is for Dr. Tedros. Thank you.
And if we understood well, the question is, what is the message to health workers in China and around the world?
The question is not clear. If you can.
Oh, maybe you can repeat the question, please. One more time, please.
Okay. As the World Health Day is approaching, what do you have to say and what kind of message do you want to deliver to the frontline medical workers in China and around the world in the global antivirus effort?
I think I have said it earlier. As you know, this is the year of the nurse and the midwife, 2020. And we were ready to celebrate it in a big way. And it was the main event actually in our, was supposed to be a main event in our assembly in mid-May. Unfortunately, there is we are in this situation.
We're up to 8,658 new cases. Overall, we have 130,000 people who tested positive, 16,000 people in our hospital system, 13,000 people have been discharged. Number of deaths are up once again. Number of people we lost, number of New Yorkers, 4,758, which is up from 159, but which is effectively flat for 2 days. While none of this is good news, the possible flattening of the curve is better than the increases that we have seen. New York is still far and away the most impacted state. New Jersey is having real difficulty, and been speaking with Governor Murphy from New Jersey, and anything we can do together, we will. Michigan also. California has leveled off, and Louisiana is having a difficult time, so they're in our thoughts and prayers. Total number of hospitalizations are down. The ICU admissions are down, and the daily intubations are down. Those are all good signs, and again, would suggest a possible flattening of the curve. The number of discharged is down, but that reflects the overall reduction in the numbers. Big question that we're looking at now is what is the curve? And we've been talking about cases increase until they don't. When they stop increasing, then what happens? And the projection models have a number of alternatives. Some suggest basically the curve goes up and then drops precipitously. Some suggest there's a slight pause at the top. Some suggest there's a longer pause at the top, which is effectively a plateau effect. Or again, the straight up and straight down precipitous drop, which is the peak effect. No one can tell you which will occur. They say any one of the three options. You study other countries, you've had a combination of the above. We are studying it as we have used the projection models from day one to determine actually what we do. How do we set policy and program? By following the data. Dr. Malatras has been working on the numbers, working with the statisticians and the projection models, and helping us incorporate that into an operational model. And Jim, if you want to just take a moment and speak about the projection models here, please.
Great, thank you, Governor. As the Governor said, we have been looking at projection models from the beginning to determine the size and scope and severity, and the Governor has mentioned this over his briefings. We've been working with many organizations and using their data like Imperial College, the Institute for Health Metrics and Evaluation, Cornell, McKinsey, and others. And some of the initial projections that we first saw at the beginning of this was at least 100, up to 110,000 beds for COVID patients alone. And the peak would come at the end of April. Those were some of the earliest modeling from many organizations, that it would be at the end of April, around 110,000 beds just for COVID patients. There are other models, two that we were tracking, one being lower at about 55,000 COVID beds, but again, peaking at the end of April. We follow now that we have a pretty robust data set to go by for the last several weeks. The bottom line there, the purple line, is sort of where we are tracking today, which suggests it's a little lower. And the question was, what could you do to lower those initial projections from 110,000 and from 55,000? So a lot of the activity was, we saw where the statisticians and the folks looking at these types of models said it was going. So what activities and actions could you take to aggressively lower that overall number? And the answer really was, and what the governor has been doing, was aggressively enforce and enact social distancing to lower the overall number. And this number and the current data suggest that that is exactly what's happening. And it's not settled yet because we are going day by day, and the numbers, as the governor says, has changed a lot over the time based on what numbers come in. But this could suggest that we are indeed potentially at the apex, or beginning to be at the apex at this moment. Like the governor has said, there's been a range of models, 7 days, 14 days, 21 days, 30 days. It looks like we're towards the earlier side of that time frame based on the current projections and modeling that we've been looking at.
Thank you, Jim. But you also see on these, you see on this slide where we are now, right? And it can still go any way. We could still see an increase. So it is hopeful, but it's also inconclusive. And it still depends on what we do, right? These models all have a coefficient of what we do and how successful we are at social distancing, et cetera. And from our decision-making point of view, it doesn't really matter if we've hit the plateau or not, because you have to do the same thing. If we are plateauing at a very high level, and there's tremendous stress on the healthcare system. And to say to this healthcare system, which is at maximum capacity today, right? This is a hospital system where we have our foot to the floor and the engine is at red line and you can't go any faster. And by the way, you can't stay at red line for any period of time because the system will blow. And that's where we are. We are at red line. People can't work any harder. The staff can't work any harder. And staying at this level is problematic. And if we are plateauing, it's because social distancing is working. So we have to make sure the social distancing actually continues. On the relieving the pressure on the hospital system, which is unsustainable at this rate, we're continuing what we call our Surge and Flex program, where we get all the hospitals on the line on a daily basis. They're all doing inventories, they're all doing data sheets, they're all on the telephone, and we're shifting among the hospitals, ventilators, PPE equipment, who has gowns, who has masks, and that happens on a daily basis, that adjustment. Also, to relieve pressure on the hospital system, the Javits coming online is a very big deal. That is the relief valve for the entire downstate system. The 1,100 military personnel started to come in. 300 were sent to New York City public hospitals to help the New York City public hospital system, the H&H system, which has been under stress. The rest will be going to Javits to bring that up and running to full capacity. That transition is happening now. That is a COVID center now, started as non-COVID, it's now a COVID center. The majority of the military personnel will be coming in tomorrow and the next day, but that Javits Center is going to be a major relief valve. Second, the United States Navy ship Comfort. The original plan was that would come in for non-COVID people. The original plan was it would also be a relief valve on the hospitals, but not for COVID people, that it would take all the non-COVID patients, if you will, from the hospital system. That was the plan. As it turned out, there's not a lot of non-COVID people in the hospital system, which is a separate story, happens to be a good news story. A byproduct of shutting everything down is you have fewer car accidents, crime rate is way down, fewer trauma cases, so there is not a large non-COVID population in the hospitals. I'm going to call the president this afternoon and ask him to shift the Comfort from non-COVID to COVID. Then we would have Javits and the ship Comfort as a relief valve. That's 2,500 beds and 1,000 beds. That's 3,500 beds, which could serve as a relief valve for the whole downstate hospital system. That is the only way we sustain this level of intensity in the hospital system. And I understand what the original plan was with the comfort, but I understand that there is no preordained strategy here. You have to feel it out day to day, and you have to adjust with the facts. And we don't need the comfort for non-COVID cases. We need it for COVID. If we had those two facilities as a relief valve, that would make a significant difference. Now, bringing online 3,500 beds is no small task. Northwell Health is going to help us manage those, but they're going to be staffed by military personnel. Only the military could bring in that many people that quickly with that logistical operation. And I want to thank DOD very much for their cooperation because God bless the U.S. military. We're fully aware of what they do to defend this nation, but this is a different application that we don't see every day, and they're doing an extraordinary job. So I'll call the president. He has been helpful to New York in the past, and he's moved very quickly in the past. I'm going to ask him if he can make this adjustment for us because it would be truly beneficial. We would feel much better knowing that we can sustain this pace if we could start to offload patients to these two facilities. In any event, plateau, not plateau, we still have to extend New York pause because if that curve is turning, it's turning because the rate of infection is going down. One of the reasons the rate of infection is going down is because social distancing is working. We have to continue the social distancing. Schools and non-essential businesses will stay closed until April 29th. I know that's a negative for many, many reasons. I know what it does to the economy. But as I said from day one, I'm not going to choose between public health and economic activity, because in either event, public health still demands that we stay on pause with businesses closed and schools closed. Whether we've hit the apex or whether we haven't hit the apex, you'd have to do the same thing. There's also a real danger in getting overconfident too quickly. This is an enemy that we have underestimated from day one, and we have paid the price dearly. Well, the numbers look like they may be turning. Yay, it's over. No, it's not. And other places have made that mistake. Hong Kong has made that mistake. South Korea has made that mistake. And we're not going to make that mistake. The weather is turning. People have been locked up. We've been talking about cabin fever. Now it's a nice day. I'm going to get out. I'm going to go take a walk. Now is not the time to do that. And frankly, there has been a laxness on social distancing, especially over this past weekend, that is just wholly unacceptable. Look, people are dying. People in the healthcare system are exposing themselves every day to tremendous risk walking into those emergency rooms. And then they have to go home to their family and wonder if they caught the virus and they're bringing it home to their family. If I can't convince you to show discipline for yourself, then show discipline for other people. If you get infected, you infect someone else, you go to an emergency room, you put a burden on all sorts of other people who you don't know and who, frankly, you don't have the right to burden with your irresponsibility. And people, especially in New York City, the level of activity is up. Partially the weather made it a nice day. I understand people have been locked up for a long time, but now is not the time to be lax. And it is a mistake. We all have a responsibility. We all have a role in this. We said that from day one. And we have to respect the role that we play. Because the role that we play is a societal obligation. That's how I see it. I want local governments to enforce the social distancing rules. The local governments are charged with enforcement. I want them to enforce them. And I want to be, frankly, more aggressive on the enforcement, because all the anecdotal evidence is people are violating it at a higher rate than before. So we're going to increase the potential maximum fine from $500 to $1,000. But it's not really about the fine. Nobody wants the money. We want the compliance. We are serious. And again, if it's not about your life, you don't have the right to risk someone else's life. And you don't have the right, frankly, to take a healthcare staff and people who are literally putting their lives on the line and be cavalier or reckless with them. You just don't have the right. And we want to thank all of the people who are getting us through this every day under very tough circumstances. And we see the illness rate among these essential workers, and we know the sacrifice they're making, and we should respect it. It's that simple. You have the first responders who are out there, your police officers who are out there, the transit workers who have to drive a bus and the train every day, the healthcare workers who are just doing extraordinary work. So let's respect them and let's help them. We're also going to set up a fund run by the Department of Health to assist the healthcare workers with expenses, costs, childcare, et cetera. I want to thank Blackstone for making the first contribution to that fund of $10 million to assist the first responders. I hope other individuals and corporations follow their lead. We're also very aware of the mental health aspect of this situation and the stress and the isolation that this has caused. And people are trying in their own way to grapple with what this means and what is the impact. How do you rationalize this situation? And the mental health aspect of it is very real. Headspace is going to partner with New York. They're an app. They're going to have content for New York and free membership for New York. So we thank them. But we also have an emotional support hotline. We have thousands of mental health professionals who have signed up to volunteer to provide mental health services. So we want people to make sure they know about that and it's available. I talk about perspective a lot, maybe frankly because partially I'm speaking to myself. And I had a good conversation with my daughters last night, Cara and Michaela, who are often wiser than I am and wiser than their years. It's very hard to see the number of deaths we're having. It's frightening, it's disturbing, that amount of loss. I'm the governor of New York. I see my job as preventing that kind of disturbance and negativity and loss for the people of the state. Perspective, we like to think that we can control everything. We can't. We like to think that we can fix everything and fix all the problems for people. We can't. The undeniable truth here is that this virus is a deadly enemy, and we will lose, and we are losing people who are vulnerable to the virus. That can't be controlled. That can't be fixed. Why? That's Mother Nature. That's a question that God can only answer. But control what you can. Do what you can. The challenge is to make sure that we don't lose anyone who could have been saved if our healthcare system was operating fully. Don't lose anyone who you could save. That is a legitimate, ambitious goal of government. And that we have done so far. That we have done so far. Have we saved everyone? No. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying and not for lack of doing everything that we could do as a society, not only as a government and as a healthcare system. So to the extent we can find peace in that, it helps me. And we are still New York tough, and New York tough means tough, but tough in a New York sense also means compassionate. It means that we are unified. It means that we are loving, because if you're really tough, the really tough guys, they're tough enough to show love. And because we're smart. And that's how we're going to get through this. Questions?
It's drug trial of hydroxychloroquine and chlorine going.
We've allowed usage of the hydroxychloroquine with the zithromycin pack in hospitals at their discretion. The federal government is going to increase the supply to New York pharmacies. We had a 14-day limit on how much you could buy because so many people were trying to buy it. If the federal government increases the supply to New York, which they say they're going to do, then we could lift the 14-day limit. There are a lot of people who rely on this, who were relying on it, people with lupus, et cetera. The tests in the hospital, they won't say that they're too short a period of time to get a scientific report. You know, hospital administrators, doctors want to have a significant data set before they give a formal opinion. Anecdotally, you'll get suggestions that it has been effective, but we don't have any official data yet from a hospital or a quote-unquote study, which will take weeks, if not months, before you get an official study. Is that a fair statement?
So promising but not conclusive, it sounds like.
On which?
On that type of treatment in hospitals.
Yeah, there has been anecdotal evidence that it is promising. That's why we're going ahead. Doctors have to prescribe it. There are some people who have pre-existing conditions where it doesn't work, or they're taking medication that's not consistent with this treatment. But anecdotally, it's been positive. We'll have a full test once they have a large enough sample and data set, Jesse. But anecdotally, it's been positive. And if we get an additional supply, we can, which the federal government says they're going to send. I'm going to mention it to the president, actually, when I call him this afternoon with the comfort. I'm going to make a note right now. If they increase the supply, we can lift the 14-day limit ban.
Governor, earlier today, there was the notion that the city would maybe be burying these COVID bodies in parks in New York City. Wondering, one, have you heard of that? And two, is there any way the state can lend assistance with managing these bodies? And what do you think about that?
I have heard nothing about that. I've heard a lot of wild rumors, but I have not heard anything about the city burying people in parks.
Would you support that?
No.
What plan do you have to manage these bodies? I know there was...
I didn't know that there was an issue. I haven't heard that there was an issue. Has anybody heard that there's an issue? No. Does the city raise any issue? They talked to New York City. I talked to New York City yesterday. I have not heard that this is an issue.
Mayor Bill this morning requested that the state release more ventilators from its stockpile to the city. To date, how many ventilators have come from the state stockpile to the city, and have they asked for any more at this point?
They have not asked for any that they have not gotten. We're releasing 802. The city is basically responsible for the 11 Health and Hospital Corporation hospitals, public hospitals. There are 11 health and hospital corporations. 11 health and hospitals. in that system. And I spoke to the head of the system last night. I'm going to speak to, he's going to be on a phone call at 1 o'clock, Dr. Mitch Katz. He had all the equipment he needed, and I'm going to speak to him again at 1 o'clock. So if they need anything, we'll get it to them.
Combined, like that's how many?
802 for the downstate area. Now, every hospital will say to you, I am running low on everything, because they are low on everything, right? When we do these daily surgeon flex discussions, there's no margin for error, because we don't have any margin for error. We just don't have the supplies. The whole system is over capacity. So everybody is low on everything. And if they had a wish list, everybody would want, stockpile and a reserve in their own hospital. I get that. We don't have that luxury. I'm taking ventilators from one hospital on a daily basis, bringing them to another, and then shifting them back and forth so every hospital can get through this period. That's why I say it's unsustainable for us. So we're doing that with PPE equipment, we're doing that with ventilators, we're doing that with patients. If we can systematically get patients out of the hospital system into Javits and the comfort, then you can relieve pressure on the whole system. But the system is running at red line, has been for days. This is the most intense management function that we have ever undertaken. So it's not here, in this situation, it's not what they want, it's what they need. That's what I say. Everybody would want, I want to have 100 ventilators on reserve. I know. It's what you need, and that we're doing on a day-to-day basis. But everyone has what they need. There is no one who said, I'm out of ventilators and I have a critical need who hasn't gotten them.
You're calling for increases in crackdowns on social distancing, but we're getting reports of funerals and weddings in Orthodox Jewish communities in Rockland County and in Brooklyn still being attended by hundreds of people. Then
they should enforce the rule, Jesse. I don't care if you're Orthodox Jewish, Catholic, Christian, Muslim. I don't care what. It's not about religious observation.
But is there anything you can do, state police or other resources, to try to break these?
The state police will enforce it also, but let a local government. It's a job of local government to enforce. I'm doubling the fine. It's my way of saying this is serious. This is serious. What right do you have to act irresponsibly in a way that could get you sick or someone else sick, and then I have to send an ambulance to pick you up and bring you to an emergency room that's already overburdened, that doesn't have staff, doesn't have supplies, doesn't have ventilators, because you were reckless and irresponsible. You don't have that right. And I have to talk to these healthcare workers all day long. I talk to transit workers. I talk to first responders who, truthfully, nobody wants to put themselves in these situations, and I don't blame them. And they're doing it out of passion and commitment and public service. None of us has the right to be reckless in our own behavior, which compounds the problem we're dealing with. Now is not the time to be playing Frisbee with your friends in the park. It's just not. Now is not the time to go to a funeral with 200 people. Look, I'm living this with my own family. Yes, I understand grieving, and I understand how the religious services can help with the grieving process. And I understand how it's hard not to do that. But as a society, the risk is too great. Enforce the law. The localities have the legal right and responsibility to enforce the law. My doing the penalty, raising the penalty, is my way of saying, do it. Just do your job.
What percentage of available ventilators in New York are being used today?
Oh, all of them. We're beyond capacity.
What about the stockpile, like how much remains in the state's stockpile?
We're beyond capacity. We are into the Plan B, C, D that we outlined, right? We are into using BiPAP machines instead of ventilators. We're into splitting ventilators, turning 2 into 1 with 2 sets of tubes. We are into all backup plans that we had.
So how many ventilators are still in the state stockpile, though, at this point?
The stockpile, I don't know. I can get you the number, but we are over capacity for the number of ventilators in the whole system. We're using BiPAP machines, we're using splitting, et cetera.
I guess that begs the question, though, why not? If there are still ventilators in the state stockpile, why don't you send them to New York, to the city?
No, we don't have anyone who says they need them now who doesn't have them.
But you just said they're over capacity.
Well, they're using the Plan B, C, D. We can't give everybody a ventilator for every situation. We have 9,000 BiPAP machines, for example. We're using the BiPAP machines, we're using the other machines. But we don't have anyone who says the 802 that we're sending today represents the number that people say they need now. Let me say that.
Elections, 10 people have gotten sick and 3 people have passed away. Do you think they should continue working processing petitions or challenging petitions?
We extended the deadline, the voting and filing deadline. So I don't know what else legally that we could do than extend the deadline. You'd have to cancel elections, period, for the year. And I don't think we're in that position. We've extended the use of absentee ballots.
Governor, are portions of nursing homes being set aside to treat COVID patients?
Are portions of nursing homes being set aside to treat COVID patients?
We're working with the nursing homes and trying to cohort patients within the nursing homes. Remember, this is something which we've identified in multiple nursing homes across the state.
So does that mean you'll be moving COVID patients to facilities that are otherwise COVID-free?
No, within those nursing homes, we're working to make sure that we minimize the spread of the COVID disease within that place, that facility.
And Governor, regarding unemployment, I'm sorry.
In other words, what Dr. Zucker is saying is when you have a COVID patient who has been in that facility, they're trying to isolate the COVID patients on one side of the facility. We're not using a nursing home to treat COVID people. We're not bringing a COVID person into a nursing home.
Regarding unemployment, is there any break in that log jam? And we're hearing that people who are on the hook to pay child support or spousal support who are out of work are having difficulty coming up with the money. Can the state help them out in any way?
The Labor Department website, the unemployment website, do you know anything about that?
Yeah, so we've now partnered with Google. We're going to be releasing a new interface by the middle of this week. They've moved from 5-day-a-week hotline to 6-day-a-week headline. They're now 7-day-a-week headline. They've expanded the hours. We've gone from 4 servers to 50 servers. They're trying to do the queue by last name so that if you're between A and D, you call on Monday, and separating them out to try to manage some of the volume. But just so everyone understands, at the peak of the 2008 crisis, in the single largest day of claims was 13,000 in one day. We had 6 times that 2 days ago. So this volume is something that we've never experienced before, and it's frustrating and it's horrible and it's unacceptable, but we just ask that people remain patient, and we are working at it. We just put 300 more people in addition to the 700 people that were manning the call system. So we are trying to do everything we can to attack this issue. And most importantly, you will get your benefits going back to the date of your actual unemployment, even if there's a lag in being able to get signed up for the benefits.
The border regions this morning announced they were canceling the regions that were going to be held in June. Do you agree with that decision, or are they planning?
I haven't even looked at their decision on the regions. It sounds right, but I haven't even looked at it.
The de Blasio administration canceled the pilot program to open streets for New Yorkers in order to encourage social distancing, et cetera. But they announced they're shutting that down because there weren't enough New Yorkers to justify that. What do you think about that? Was that a failure of that attempt? And also, you just increased penalties, so what's going on here?
I don't know. You know, New York City localities make decisions on their own on local issues. So I have no reason. I don't have any opinion on what the mayor did. I just don't know the facts well enough on that program. The social distancing We have, again, hopeful news in the data that it could be slowing, plateauing, turning, but it's also dependent upon what we do and how we handle ourselves. And we know that social distancing is important. That's why I'm extending the ban on keeping businesses closed, extending the ban on schools. But people, it's individual behavior that has been problematic over the weekend. I get that it was a nice day and the weather was good and people have been cooped up. I get it. I get it all. I'm living it just like everybody is living it. But we get reckless, we change, or we're not compliant on social distancing, you will see those numbers go up again. That's why I showed you the Hong Kong, the China experience. They let their foot off the gas too quickly. And we have been behind on this virus from day one. And this virus has kicked our rear end. And we underestimate this virus at our own peril. We learned that lesson. Now is not the time to slack off on what we're doing. One more question. We are moving ventilators now among the system. When someone has a change in patient load and they have additional ventilators, we move ventilators. But we have moved thousands and thousands of ventilators throughout the system. We've acquired thousands and thousands of ventilators. I also want to thank Oregon for sending ventilators. I want to thank the state of Washington for releasing ventilators and suggest that they be sent here. I want to thank California that also this morning released ventilators because they thought that they could be helpful to New York. That is the right attitude. That's the only way we do this as a nation. We're going to have to be flexible and handle the surge as it moves across the country. That's just what we're doing here in this state. Surges in Nassau one night, we move assets to Nassau. Surges in Rockland, we move assets to Rockland. So that's the only way we're going to do it, because the federal stockpile. If the federal stockpile has 9,000 ventilators or 10,000 ventilators, that's not going to do, it's not going to be enough for a nation, right? So you're going to have to get states cooperating and shifting and moving within the country. New York will be first on that list. As soon as we get through this and we have any flexibility in our system, we will be there for every other state, like they have been there for us. And we will lead the charge, the way we always have. Hurricane Katrina, we were the first ones down there, right? So when anyone needs anything, we're there. Right now, healthcare-wide, I'm going to get on the phone with the hospitals now. There is no hospital that needs ventilators that doesn't have ventilators. There's no hospital that needs PPE that doesn't have it within the state system. Again, they're all going to say they're running low because they are, but nobody doesn't have what they need to do their job. And that's my point on perspective. Are we managing this situation the best it can be managed? Yes. Have we lost anyone who we could have saved? I don't believe so. And with that, we can sleep at night. I have to go to work. Thank you, guys. We don't need any additional ventilators right now. And we have California has released ventilators. State of Washington has released ventilators. We got 1,000 ventilators from China. So right now, we're okay. I'll see you tomorrow.
that qualify who we do need to help. If you're working reduced hours, down to 10 hours a week or less, we will soon announce how you will be able to qualify for the CERB. This is to help you if you're a gig worker, a contract worker, or a volunteer firefighter. We'll also have more to say for those who are working, but making less than they would with the benefit. I'm thinking in particular of home care workers or long-term care workers looking after vulnerable seniors. And I know there are also lots of university or college students wondering what kind of job you'll get this summer. You need support now, and work is underway to get it to you as soon as possible. For people in all of these situations, we see you. We're going to be there for you. And we're working as hard as we can to get you the support you need. At the same time, we also announced a new 75% wage subsidy to help you keep your job and help businesses keep their employees on the payroll. Right now, we're drafting legislation and talking to other parties ahead of bringing Parliament back to put the wage subsidy in place as quickly as possible. Supporting you and your family is our top priority. Your Minister of Finance, Bill Morneau, will have more updates soon, but here's the bottom line. Whatever your situation, we are working to get you the help you need. Si vous êtes né en janvier, en février ou en mars, et vous avez dû arrêter de travailler à cause du virus, vous pouvez présenter une demande pour la prestation canadienne d'urgence à partir d'aujourd'hui sur canada.ca. Sinon, vous pourrez soumettre votre demande plus tard dans la semaine selon votre mois de naissance. Vous êtes nombreux à avoir besoin d'aide rapidement et on doit s'assurer que le système fonctionne pour tout le monde. Si vous optez pour le dépôt direct, ça devrait prendre 3 à 5 jours pour recevoir un premier paiement. La prestation d'urgence vise à aider tous les Canadiens qui ont besoin d'un coup de pouce, mais je sais que certaines personnes ont encore besoin de soutien et ne sont pas encore admissibles. Si vos heures de travail ont été réduites, par exemple à 10 heures par semaine ou moins, on va bientôt annoncer comment vous pourrez toucher à la prestation canadienne d'urgence. On aura aussi des nouvelles pour ceux qui gagnent moins d'argent en ce moment que s'ils touchaient la prestation. Je pense par exemple aux professionnels des soins à domicile ou ceux qui s'occupent des personnes âgées. Il y a aussi beaucoup d'étudiants au cégep ou à l'université qui se demandent ce qu'ils vont faire cet été. C'est clair que vous avez aussi besoin d'aide et on travaille fort pour trouver des solutions. En même temps, on travaille sur un projet de loi et on collabore avec les partis d'opposition pour rappeler le Parlement et mettre en place les mesures qu'on a annoncées le plus rapidement possible. Le ministre des Finances, Bill Morneau, donnera plus de détails bientôt, mais voici ce qu'il faut retenir. Peu importe vos circonstances, on fait tout ce qu'on peut pour vous aider. On travaille très fort pour vous donner un peu de répit et vous aider à gérer votre situation financière. Les banques ont un rôle important à jouer parce qu'elles ont le pouvoir d'aider les entreprises à poursuivre leurs activités et les familles à payer leur hypothèque. Aujourd'hui, je tiens à saluer la décision des 6 grandes banques et de certaines coopératives de réduire de près de la moitié les taux d'intérêt des cartes de crédit pour les Canadiens éprouvant des difficultés financières à cause de la pandémie. The decision of the 6 major banks and of certain credit unions to cut credit card interest rates almost in half for people in financial difficulty because of the pandemic will give them much needed relief on debt. I also want to thank Minister Morneau for his outstanding leadership on this. And we need to see even more action like this going forward because this is a time to think about each other, not about the bottom line. On that note, I want to recognize the new initiative the Canadian Chamber of Commerce launched in partnership with our government. The Canadian Business Resilience Network will help businesses of all sizes get through this tough period, not just get through this tough period, but drive our economic recovery afterwards. This builds on what we've already done to help business owners. We have a 3-point economic plan. It supports business owners, including through new loans, while safeguarding jobs with the wage subsidy and helping those who no longer have a paycheck with the CERB. We're here for you. In order to get through this and keep our loved ones and our frontline workers safe, all Canadians need to do their part. Don't forget that you are shaping our future today. What the next weeks and months look like depends on you. It depends on whether you stay home, whether you help protect the vulnerable and make sure our hospitals aren't overwhelmed. Chaque citoyen doit faire sa part. Parce que les gens qui doivent continuer d'aller travailler, les infirmières, les médecins, les ambulanciers, les techniciens de laboratoire, les concierges, les camionneurs et les travailleurs agricoles, entre autres, font plus que leur part. Ils font des sacrifices pour permettre au reste de la population de rester chez eux. La meilleure façon de les remercier, c'est de continuer à suivre les directives des experts en santé. C'est comme ça qu'on peut tous protéger notre santé et la leur. Merci d'être des nôtres aujourd'hui.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Alex Ballingal, Toronto Star. Line is open.
Good morning, Prime Minister. Premier Ford in Ontario reportedly told CBC News this morning that Ontario could run out of personal protective equipment within a week, and that the U.S. has stopped a shipment of equipment last night. I'm wondering what your reaction to that is. That impending shortage in Ontario? And can you tell us if the U.S. has actually stopped any shipments of goods into Canada?
We are working very closely with all provinces and monitoring the levels of personal protective equipment and the challenges they're facing both on procurement and on making sure that our health officials, healthcare workers across the country get the kind of help that they need. We continue to have productive and positive conversations with the United States, emphasizing for them that healthcare supplies and workers across the border are very much a two-way street, and we need to continue to enable us to be there for our neighbors because it's in our collective interest. Minister Champagne had a good conversation with Secretary Pompeo this morning. Those conversations are continuing, and we expect those supplies to be delivered. Depuis le début, nous travaillons avec les premiers ministres des provinces pour s'assurer qu'ils ont assez d'équipements pour protéger leurs travailleurs dans le système de santé. On est très conscient des inquiétudes que les gens ont de ne pas en avoir assez dans les jours ou les semaines à venir. C'est pour ça qu'on est en train de travailler très très fort pour en recevoir d'à travers le monde et aussi pour commencer à en produire ici au Canada. Je peux souligner que nous continuons d'avoir des conversations extrêmement productives avec les Américains, dont le ministre Champagne avec le secrétaire Pompeo ce matin, et nous nous attendons à ce que ces produits soient livrés.
Follow-up question?
Have you, I guess just to repeat that question has there been any shipments that have been stopped that we were expecting to get? And have you received any assurances from the Americans that they will allow these to go through?
As I said, there are very productive conversations ongoing, and we expect those shipments to be delivered.
Thank you. Next question.
Thank you. Merci. Next question, Jim Bronskill, the Canadian Press. Line is open.
Good morning. We're wondering if you can update us on any of the efforts to ensure that people are quarantined who need to be quarantined. Do you have anything to tell us today about whether anyone has been quarantined? And if so, are there any numbers on that score? Thank you.
Anyone returning to Canada is subject to a mandatory quarantine order. That means they have to go straight home from the airport and stay home for 14 days. Public health officials are following up with a number of those people, particularly some of the higher risk or challenging cases. We are confident that Canadians right across the country are obeying the quarantine orders and making sure that they're doing everything they need to do to keep themselves and their loved ones safe.
Follow-up question?
Is there any sense beyond the normal quarantine procedures whether the Quarantine Act has been invoked in special cases and people have actually been forced into quarantine in centers or other locations under the Quarantine Act?
From the very beginning, there was a number of measures that we took on returning flights from Wuhan, for example, on flights coming back from various cruises, where we had mandatory quarantines in centers. We have facilities available for people who are returning to Canada and for various reasons cannot quarantine themselves at home or home is too far from the airport. That is why we have institutions in place, and those are being used.
Merci beaucoup. Prochaine question.
Thank you. Merci. Raymond Fillon, TVA, à vous.
Oui, bonjour, Monsieur le Premier ministre. Vous avez dit